Caraga Contra COVID-19, bringing you the updates of the Corona Infectious Disease 2019. Maayong adlaw Caraga Region ug sa mga gasubay online. Kini nga programa giuluhan sa Department of Health, Caraga.
Mayong adlaw, aniya na sabta karon sa programang Caraga Contra COVID-19. Ug karon ako yawag ato Regional Director Jose Arlecuna Jr. para sa paghatag sa Caraga Situational Report and the assessment of the team for the subnational laboratories and DOH retained hospitals.
Greetings of good health and peace. Mga kaigsunan on the national scene, we already have 6,459 COVID-19 infections. 428 died and 613 have already recovered. Sa Caraga mga kaigsuunan, duha ka buok atong confirmed COVID-19 infection. One was already discharged and is on the road to recovery. Ang usa still admitted at Caraga Regional Hospital. Probable cases, wala din sa Caraga. Sa suspect cases, as of today, we have 19 in all, although 15 are the ones in the facilities now. One in Caraga Regional Hospital, wala diha sa Adela Cerati Memorial Medical Center. Sa Butuan Doctors Hospital, tulo. Sa Butuan Medical Center Main, usa. Sa Annex, tulo. Sa Bislig District Hospital, usa. Sa Esperanza Medicare Community Hospital, usa. Dito sa 401st Infantry Battalion Quarantine Facility sa Prosperidad, duha. Mauni ang duha ka patients coming from Davao, which is a locally transmitting area. Usa-usab dito sa Tandag, nag-home quarantine, usa sa Kabadbaran. The 15 patients' tests are still pending already in Davao for processing. Regarding our plan to establish a subnational laboratory in Caraga, ang team sa RITM, WHO, and DOH na nibisita sa De La Cerati Memorial Medical Center and Caraga Regional Hospital niadtong last weekend. The accreditation or the establishment of a subnational laboratory is composed of 5 steps. We are now on step 2 despite primero pa nilang bisita sa facility. I'd also like to inform you that the City of Government of Butuan is planning to establish a PCR laboratory of its own, although it's still in the preparation phase.
Salamat Director Lacuna sa paghatag sa sitwasyon sa Caraga bahin sa COVID-19. O karon aniyang atong Medical Officer 4 para sa pagklaro kung unsa ang protocol sa DOH Regional Operations Center Helpline.
Maayong adlaw Caraga Region. Ang atong DOH Operations Center nag-function kita 24/7 using our 2 cellphone hotline numbers and 1 landline number. Nag-adapt pod kita sa call first policy wherein atong gina-cater ang tanan o gi-facilitate nato ang tanan nga calls, health o non-health related nga mga concerns and issues. We have top 5 nga mga concerns nga among gina-cater every day. So ang una, tawag nga regarding checkpoint concerns, especially nga na-stranded sila sa checkpoint o ang mga products na stranded. Unsa kuno ang ilang buhaton. Number 2, naapoy mag-ask kung unsa o kanusa daw ma-release ang kaning sa DSWD nga 4-piece cash incentives. Kinsa daw ang angay nilang pangutanon ug asa sila pwede mangutana. Naapod tay calls nga naglibog sila kung unsay buhaton if magkuha og asa magkuha og quarantine certificate and work certificate or work pass. Naapoy mag-call ug mag-ask if unsa ilang buhaton kung gikan sila sa mga areas nga naay local transmission like Davao, Iligan, Cebu, and Manila, asa o kang kinsa sila muduol para makahibalo sila sa ilang buhaton. Og ang pinaka-importante nga mga calls nga among gina-cater ag facilitate everyday mao ang kaning mga masakito nato nga mga Caraganons nga suspect COVID cases as assessed and classified kung asa sila pwede nato i-refer. Immediately pag makadawat ang atong operation center sa kaning nga mga calls, atong tawagan diretso ang concern nga mga agencies, individuals or facilities para makater o makakuha ta sa mga answers nga angay natong itubag sa atong mga calls. For example, kung mag-refer kita og pasyente sa higher facilities, kung naay manawag sa operation center nga kani nga tawo na ay sakit, or ang hospital manawag mismo sa operation center nga pwede nila i-refer ang ilang pasyente sa higher facilities like Caraga Regional Hospital or Adela Charity Memorial Medical Center, among tawagan una ang ato ang mga referral hospitals, and then i-cater namo hospital to hospital referral system. Kung pwede ang doctor sa referral hospital o ang doctor sa mo-refer nga hospital dapat mag-istorya gyud og una ay nato i-refer ang pasyente para sa assessment, evaluation and further management sa atong mga patients. Para mas madali ang atong referral system, tawagan pod namo diretsyo ang atong LGU concerned, especially sa mga vehicles, ambulance nga gamiton para paspas ang pag-refer sa patient. After namo na makater o ma-facilitate ang pag-refer sa pasyente, tawagan namo immediately ang hospital nga pwede na nato i-refer ang pasyente o ang LGU para makuha na ang pasyente didto sa hospital aron madala sa ato ang mga higher facilities. Every day, daghan man gyud tag challenges sa atong operation center, especially sa mga concerns nga atong gina-facilitate. Kasagara sa ato ang mga referral cases mahitabo during nighttime. And during nighttime, medyo naatay lisod sa atong proseso sa atong pag-refer. Like for example, kaning mga vehicles nga angay natong gamiton during referral. Kinsa ang mo drive, kinsa ang vehicle nga gamiton, especially kung highly suspected ang atong mga cases. These are the challenges nga ato ang gina-encounter, especially sa pag-cater sa ato ang mga patients. And the DOH Operations Center, nagpasalamat jud kami sa mga concerns nga everyday nga amo ang gina-cater and gina-facilitate. And everyday is a learning experience for all of us. Since si COVID-19 is a new type of coronavirus, we are asking for your understanding if there are times nga ang inyong mga calls dili dayon namo ma-answer immediately. But ang DOH Operations Center will try our best na ma-facilitate namo ang tanang concerns sa manawag. Daghang salamat.
Thank you, Dr. Apare. Para sa paghatag sa mga lakang sa isa sa atong partner agency bahin sa COVID-19, ania ang Regional Information Officer gikan sa Department of Social Welfare and Development, Mr. Marco David D. Reyes.
Good afternoon. We would like to provide you the latest updates about the DSWD Field Office Caraga's report regarding the social amelioration programs. Specifically, the implementation on the emergency subsidy program, where 5,000 pesos has been provided to the informal sector families, specifically those most affected by the enhanced community quarantine due to the COVID-19 pandemic. DSWD Caraga has been allocated a total of 492,758 households or families to be part of the emergency subsidy program. As of the moment, we would like to inform everyone that all 73 municipalities has been provided with the necessary funds for the identified qualified families. That amount provided is 1,508,335,000 pesos. So out of the 73 municipalities, we have already conducted a payout to 57 municipalities, or 78.08% of the total LGUs for Field Office Caraga. We have started our payout, and a number of 114,897 beneficiaries has been given their 5,000 pesos as emergency subsidy. This amounts to 574,485,000 pesos, or a total of 38.08% of the total budget allocated for Caraga. Out of the 492,758 beneficiaries, we have also provided 653,565,350 pesos. This is to cover the 179,059 beneficiaries of the Pantawid Pamilyang Pilipino program. If you would look at the Joint Memorandum Circular, all Pantawid Pamilyang beneficiaries are covered by the Social Amelioration Program. So they have been provided with the 3,650 pesos as part of the emergency subsidy, and then the remaining 1,350 pesos will be followed in the following days. Since this budget covers the rice subsidy, which is 600 pesos, and the health grants totaling to 750 pesos. So we have provided the allocation coming from the emergency subsidy, which is the 3,650 pesos, and then to complete the 5,000 pesos, the 1,350 pesos will then be followed. There are still Pantawid Pamilya beneficiaries who do not have their cash cards, so we are currently conducting the finalization of the payroll for our Pantawid Pamilya beneficiaries who do not have their cash cards. Okay, another update, the DSWD Field Office Caraga, specifically our staff here from the regional office, are currently conducting our monitoring to the implementation of the Social Amelioration Program. We have prepared 3 teams to monitor the implementation, those areas who are currently implementing the payout, and those areas who are already done with their emergency subsidy payout. So the task of these teams are to validate on the ground, or monitor our implementation on the ground, specifically the implementation of being handled or being done by the local government units. This is to check whether the identified households or the identified families who have been provided with the 5,000 pesos really fit into the criteria that we have set, or the guidelines that we have identified as qualified families for the emergency subsidy program. We have also teams monitoring the status of the documents being prepared by the local government unit. This forms part of the agreement between DSWD and the LGU that will be conducting the actual assessment and validation of the households or the families who are qualified for the program. And it also includes the transfer of funds to the local government units, since they will be the ones handling the funds during the payout. So we are glad that during our first meeting earlier today, we had excellent feedback coming from the teams who conducted the monitoring during last Tuesday, Wednesday, and Thursday's monitoring of the SAP implementation. So we have we came up with certain guidelines to be more specific on how we will be conducting the monitoring, since this is very crucial in ensuring that those being provided with the 5,000 pesos are those who are really qualified for the social amelioration programs. This is also to check whether the identification of or the validation being done by the local government unit follows the guidelines that we have set, specifically in identifying our families or household who will be receiving the social amelioration programs, specifically for the Department of Social Welfare and Development. For our plans in the following days, we will be having our teams in the field to support the local government unit who's in charge of the payout of the 5,000 pesos. Our municipal teams have been in the field since the third week of March. They have been supporting the local government units in conducting the validation process and the payouts. And we will continue to monitor the conduct of the payouts, and we will be visiting areas who are done with the payout. So our teams from the field will be doing their stuff, and then our teams from the regional office will be doing the monitoring. We will also be able to provide our updates on the conduct of the payout for our social pension program for indigent senior citizens, since the scheduled payout for the first semester for 2020 were canceled during the community quarantine way back third week of March. Actually, the senior citizens have been clamoring for their first semester grants. So we have also been conducting the payout since yesterday, specifically for Butuan City. We have provided 3,000 pesos first semester grants, which covers January to June. Every month, our senior citizens receive 500 pesos. So for the semester, they receive the 3,000 pesos. So we have started with Butuan City yesterday, and then we will be having our schedules for the rest of the municipalities and cities in the region in the following days. So hopefully, the local government units, the AFP and the PNP will also be supporting us in the payout of our social pension program for indigent senior citizen, which our beneficiaries will be receiving the 3,000 pesos. So basically, we have a busy schedule ahead. Even tomorrow, which is a Saturday, we will be conducting the payouts and the monitoring. So hopefully, we will be able to finish all our payouts. Hopefully by next week. We are hoping that all municipalities, all cities, all 73 local government units will be able to conduct the SAP payout. So I think this is all the updates for Department of Social Welfare and Development.
Thank you, Mr. Reyes, for the updates. Hinaot nga magpadayon atong kooperasyon o pakigbisog kontra COVID-19. Sa makausab, among giawhag ang mga Caraganons na maminaw lamang sa mga opisyal na balita. Kung aduna mo'y mga pangutana or clarifications, kindly text or call DOH COVID-19 hotline numbers. DOH Caraga hotline numbers 817-6546, 0945-3592-632, 0948-224-1857. For mental health and psychosocial support services through telecounseling for Caraga State University, adunay pipila ka mga numero na pwede natong tawagan depende sa oras. For National Center for Mental Health Crisis hotline numbers, Agusan del Norte, Agusan del Sur, Surigao del Sur. Province of Dinagat Islands. For DOH official Facebook page, kindly like DOH Center for Health Development Caraga. O karon atong giyawhag pag-usab ang ato Regional Director para sa paghatag sa update sa contact tracing o iyahang closing message.
Mga kaigsunan, under the new guidelines, contact tracing now is led by the Department of Interior and Local Government in Butuan City. Regarding the second COVID-19 infection, the local epidemiological and surveillance unit is headed by the City Health Officer and the City PNP Officer. Tomorrow, during the RDC 1 Caraga Shield meeting, they will give us their output or update. My friends, even up to the present, there is a need more than ever to effectively implement strict home quarantine. To complement this effort, the Regional 1 Caraga Shield resolution states that everybody must wear their masks when they go out from their homes on necessary and essential trips. This will markedly decrease the transmission or even stop altogether the transmission of the virus. Usbon ko mga kaigsuunan, we can effectively prevent or even markedly decrease transmission of the virus doing this, including among others, physical or social distancing, frequent hand washing, cough etiquette, eating of well and nutritious foods. My friends, let us take this time to be with our family for closer family bonding. Daghang kayong salamat. Mayong adlaw kanatong tanan.
Ug mao kato ang balita karong adlaw. Daghang salamat. Stay safe, Caraga.